Hello friends, today we are going to discuss about the extracorporeal therapies in acute liver failure. So the base studied artificial modalities are based on either albumin dialysis, that is molecular absorbent reticular system, MARS, fractionated plasma separation, absorption system, that is Prometheus, single pass albumin dialysis, and high volume plasma exchange. So albumin dialysis system. The MARS was invented by Metzner and the Stage and used for first time in 1993. It is still mostly studied extra ELS system worldwide. It has been designed to circulate the patient's whole blood across the albumin impermeable 50 to 60 kilodalton cutoff membrane that is then dialyzed again. A counter current flow of exogenous 20% albumin solution in secondary circuit. Given the difference in the concentration gradient of albumin bound toxin and water soluble substance between the two compartments, toxin move from the patient's plasma to the exogenous albumin. This albumin is then recycled and detoxified by sequential passage through the charcoal and anion exchanger column. Setting up the system takes from 1 to 2 hours depending on the expertise of the team. Therapy takes place in the session, and typically each session of the MARS treatment takes around 6 to 8 hours using blood flow rate of 150 to 250 ml per minute. During therapy, there can be episode of hypotension that can be managed by reducing blood flow speed and providing volume expansion. The most frequent technical complication is the clotting of extracorporeal circuit, which leads to the discontinuation of therapy session. Anticoagulation increases the likelihood of completing treatment and is generally recommended unless severe anticoagulation disorders are associated. In addition, the risk of bleeding was not higher in patients treated with MARS versus standard medical therapy in large clinical trials. Unfractionated heparin and the regional citrate are the most widely used strategies. The slower speed of the blood flow can also increase the risk of clotting of the circuit. Therefore, balancing the severity of the liver failure and the risk of hypotension and severity of coagulopathy are important consideration when setting up the treatment for the session. Prometheus was developed by the Falkingen in 1999. It comprises fractionated plasma separation, absorption, and hemodialysis. The Prometheus patient's blood passed through the large albumin permeable, that is 250 to 300 kilodalton cutoff membrane, into second circuit where purification of albumin bound toxin take place by direct absorption on the special absorber. Afterward, the conventional high flux dialysis is performed inside the primary circuit to remove the water soluble substances. In contrast to Mars, it has advantage that system relies on endogenous albumin and there is no need for external albumin. Similar to Mars, clotting the extracorporeal circuit was the main reason for premature termination of the session, followed by hypotension and bleeding in the main Prometheus clinical trial. So SPAD is one of the simplest approach to remove the albumin-bound toxin and water-soluble substances. Like Mars, SPAD dialyzer whole blood against albumin-rich solution in a single pass through uh, dialyzer. Nonetheless, albumin is not recycled but discarded. Compared to previous modality, it has advantage that can be performed using conventional renal replacement therapy device and therefore setting is simple. Now the last modality is plasma exchange. High volume plasma exchange, that is three times plasma volume, has been widely used in other medical condition and it has started to prove clinical efficacy in patient with acute liver failure and ACE. Its mechanism is based on the plasma separation from whole blood for removal of the plasma cytokines and the drivers of systemic inflammation, with subsequent replacement of the fluid, most commonly with fresh frozen plasma. Recent studies suggested that effectiveness of therapeutic plasma exchange using lower doses, that is 1.5 to 2 volumes of plasma with fewer adverse events. In recent years, therapeutic plasma exchange has become routine therapy in patients with ALF in several centers, given its effectiveness, safety, ease of use, and low cost compared to other therapies such as albumin dialysis. It is important to remark that replacement solution used is effective. Therefore, INR cannot be used as prognostic marker after initiation of therapeutic plasma exchange. So this is the diagrammatic representation of Mars. The first diagram is showing molecular absorbent recirculating system. Then second is showing the pictorial representation of fractionated plasma separation and absorption. That is the principle of Prometheus. Then third one is single pass albumin dialyzer. And fourth one is dialysis. Thank you guys.